Welcome to In a Heartbeat. I'm Liz Aiken. You know this show's coming to you from the studios of the Grosse War Memorial, Grosse Farms, Michigan. You are watching WMTV. I have a show with a physician whose specialty is sports medicine. Her name is Dr. Shelley Street. We have a lot to talk about, and it really is a lot of things that can make a difference for all of us, starting literally. As you watch the show today, take it to heart. Get moving. So I'm really pleased to have you here, Dr. Street.
Thank you. Thank you, Liz, for having me.
This is great. Great grip, I'm telling you. So I can tell that I asked you off camera to begin with, how did you ever get into sports medicine? You are an MD.
Yes.
And you decided to go into sports medicine. Why sports medicine?
I decided sports medicine around after completing medical school and starting residency. It's an interest always been there. I played intercollegiate basketball, and in high school I ran track, ran cross country, and played basketball as well. I'd had multiple injuries like many of us had, and if you have kids, you know you've had multiple injuries, multiple falls, and at some point, not sure if I was treated appropriately for some of those injuries and some of those falls, and continued to have problems over and over and over again. And then went to college and actually played in college and had experience with the team physician in college. Enjoyed that experience as well. Finally got some adequate treatment for some of the problems I was having, was able to excel at my sport. And then went into medical school and just decided, I'm going to be a pediatrician.
Oh, sweet.
And I want to take care of people. And I liked both internal medicine and pediatrics, did that residency, and thought that maybe, okay, sports medicine was just something that I thought about, but found out that you can do that as a subspecialty. And it perked my interest. Volunteered at some of the high schools and being a mentor and being their team physician. And went into sports medicine from there. Did the fellowship in sports medicine at Henry Ford Health Systems, and then practiced sports medicine afterwards. So it's been kind of full circle. A way of not ever getting out of sports and always playing.
Right. That's right. Plus, you are board certified in pediatrics and internal medicine.
Correct.
So you really run the gamut. From the and I was starting to say in the beginning, you have a great grip, so yeah, you're in the right field.
Yeah, well, you had to have a good grip to hold on to the basketball.
To get the basketball. This is so cool. And we'll get to this basketball. You have, and it's funny because you actually work with Dr. Lemos.
Correct.
And Dr. Bali, David Bali, did an interview with Dr. Lemos talking about being, the Tiger, as a Tiger team physician, and his background in it. So this is so fun. And you and I have known each other for many years from Beaumont Hospital, Grosse Pointe. So this is and as I find with a lot of physicians, it's a conversation. It's been an ongoing in-hospital conversation. It just takes a while to make its way to the table in this studio. So this is perfect. I'm really glad that you are here. Okay, so you are board certified in both. Explain to me, what actually is sports medicine? What does this encompass?
The sports medicine for the physician who's been trained in internal medicine, pediatrics, family practice, even emergency medicine or physical medicine and rehabilitation, a little bit different than those going into sports medicine from orthopedic surgery. And so our focus is more on the health and welfare of the athlete, appropriate training, preventative measures, appropriate screening for preparation for sport, appropriate treatment for injuries that we know aren't going to require surgery. About 85% of the sports injuries are non-surgical injuries, so we take care of a lot of those injuries.
How much? What's the percentage?
About 85%.
Wow.
Most injuries in sports
really.
are not surgical injuries. They don't require a surgery. Kids sometimes, when you take fractures out of it, so if someone falls doing something and they had a fracture, kind of different story, but if you take fractures out, most injuries don't actually require any kind of surgical, and even the fractures don't always require any type of surgical intervention as well. But there's a large amount of sports medicine outside of just the injury, the management of the athlete who has asthma or bronchospasm, the management of the athlete who may have a chronic ankle sprain, or someone who has diabetes and is also being active, the athlete who gets an infection during the season or before the season. Right now it's wrestling season. And this is
Yes,
one
I
of
know.
the,
My
one
son
of the
wrestled.
times when you have to have a physician screen the skin to make sure they don't have a communicable disease that they can give to someone that they're wrestling against or for. And soon the Michigan High School Wrestling Championships are coming up, and that's one of the events that I help cover. So,
Oh my gosh.
you know, those are some of the things that you do as sports medicine, along with cardiovascular fitness and better training, et cetera.
You just basically read my mind on that one, because I know Beaumont Hospital in Royal Oak has done the program where they do the screening for athletes in the fall. Beaumont Hospital Grosse Pointe has now started that, where they're doing this screening. And we have seen on occasion on the news, on the web, whatever, of an athlete seemingly in perfect physical health going onto the field in whatever the sport is, and even the one with the wings where the person dropped. And so with these screenings, you hopefully can maybe pull out the athlete who just needs to fine-tune something physically for them, so that this is not a threat later down the road. This is catastrophic.
Those catastrophic events are absolutely it's traumatic to the community. It's even more traumatic to the family that has to experience that. It's surprising to the greater society, because we think of these young people as being really healthy, and there shouldn't be any reason. They're doing the things that we're supposed to be doing. They're exercising. You know, how can they all of a sudden have an event when they're exercising and they're supposedly healthy? And it's been difficult for us to figure out exactly what we should be doing to make sure that we screen appropriately to prevent these from occurring. And currently, what is recommended is that we do an appropriate history about their family, about themselves, about any symptoms that they may have, about symptoms they may have had in the past, about symptoms of family, and an appropriate physical exam. And from those, most of the cases of at-risk people we're hoping can be identified. And from that at-risk group, we go from there. Now, there is a group of people looking at what is the value of screening everybody with the EKG. And right now, we don't have definitive answer about should we be doing that or not. There's a big controversy over should we be doing that or should we not be doing that.
And do you mean this is doing an EKG on any
on
young
every
adult?
single person who participates in sport?
In
That's
sport,
that's
okay.
the question of if we should be doing it. Currently, is not recommended. But the question is, should we be looking into doing that in the future? And there's lots of reasons we maybe should, and lots of reasons why we maybe should not be doing that.
Right.
So that's still up in the air.
Right.
So we do the best with what we have and what we know currently and what's recommended. And you should get good questions and good physical exam and make a determination from that.
And really, too, for the athlete coming in for the physical is then for that person to even know what their family history is. And maybe that is even part of the process of teaching them what they need to know. Or if they are old enough to come in without a parent or don't want a parent there, but they need to then themselves know what questions do they ask before they even get to the physician's office.
That's correct. And then
It's a lot.
for the teenagers, I actually encourage them. I have a questionnaire that they go through, and I encourage those teenagers to do it with their parents so that they can learn about their family history. Some of them
That's
don't
fascinating.
know.
Right,
You know,
that's right.
they have no idea what happened to their parents' siblings or their